post-event massage techniques. This would be done to assist in the cool down process, to bring fresh blood to the area after use, and also to prevent onset soreness the next day after use of the muscles. We would also be looking to try and relax and reduce any adhesions in the tissues that might occur after the use during the exercise. You may want to start with some shaking or some rolling to generally reduce tension in the muscles. So we could do some rolling by just gently pushing the leg inwards and outwards at a frequency that just got the patient to fully relax and let go of their muscles. Instead, or as well as rolling, we could do some shaking to again just get the muscles in the leg to completely relax. So we'd want to bring some traction on by pulling the leg towards us, using our body weight, leaning back, and then we would just shake the leg up and down, finding a frequency which meant that the patient didn't hang on to their leg, but actually allowed us to actually shake their leg up and down with no resistance. About a 20 to 30 second vibration would get all the muscles nice and relaxed and allow us then to actually get into the tissues with less resistance. So the key technique in a post-event massage is effleurage, to bring fresh blood with oxygen to the deplenished tissues, and also to just flush all of the toxins out of the system. The main difference from pre-event is that our effleurage techniques are now much slower and more purposeful. So we're looking at really trying to push all the waste products out of the system into the lymphatic waste system. So we're looking at generalized effleurage techniques, really purposely pushing towards the lymph node in the groin. With a slow but steady pace to aid relaxation. Once we bring some warmth to the tissues and started off actually the flushing of the waste products, we can then bring in other techniques to also start to actually stretch any adhered tissue and actually make sure we relax the tight tissue. So for that we could bring in some generalized petrissage techniques like our kneading, again reasonable steady pace, just to make sure that the patient completely stays relaxed. We would alternate between deeper petrissage, going back into our effleurage techniques. Mixing and matching whichever effleurage techniques you choose, appropriate to the area you're working on. Instead of kneading, we can use some wringing to really try and separate the fibers and stretch out the muscles that have been used. or we could use some picking up. Again, to just work through all the soft tissue fibres and try and get them to separate from each other to prevent any adhesions. And break that up again back to our effleurage techniques. Whilst we were doing our petrissage techniques, if we found any real areas of tension, we could justifiably do a compression to that area to try and actually bring about some release in that localized area. So if we found an area that was particularly tight, we could sink in with a compression using whichever applicator you prefer, such as the heel of your hand. So we just push into that area until we felt the resistance in that area or until the patient felt some pressure. Do you feel that pressure? Okay. And then we would hold that until we got a clinical effect. So either that releasing under our hand or until the patient felt that release. Usually a maximum of 30 seconds. So I can feel that start to release. Do you feel that's easier? And then we can go back in and just have a feel and see if we've got less resistance now and that area feels easier to actually move. If it didn't, we could go back in and do another compression. So we would continue for maybe 5 minutes maximum, not overworking the tissue, to make sure that we don't actually cause any further discomfort. Finish off with some effleurage to make sure we get rid of any waste products that have been actually released through our petrissage techniques. And then a nice way to finish the post-event massage on a muscle is to stretch out the area that you've just tried to actually release. So to stretch out the quads, we would get the patient to turn onto their side. So just turn to your side facing away from me. And then we would just bring them into a passive stretch, just bringing the leg back into hip extension with our knee flexion. To stretch the quads further, I can step outside the leg and bring on more knee flexion. Get the patient to feel that stretch. You feel that there? Yeah. And then we're holding that for at least 20 seconds with a static stretch. And then we would move on to the next muscle group that we wanted to work for the post-event. So if you want to turn onto your tummy for me. And we could set up, now working on the hamstring and repeating what we've just done, but to the next muscle group.